Big Hearts, Big Trouble.
University of Texas, Rio Grande Valley, Knapp Medical Center. Introduction. Dysphagia is described as difficulty with swallowing, usually presumed to be secondary to esophageal abnormalities. We present a rare case of a giant left atrium causing dysphagia complicated by unintentional weight loss. An 81-year-old male with a past medical history of atrial fibrillation on chronic warfarin, diabetes, hypertension, and gout. Dysphagia is a fairly common clinical condition said to affect about 22% of adults over 50 years of age in the United States. However, to the best of our knowledge, this is the first being reported in an individual of Hispanic origin. The 81-year-old male presented to the ER due to progressively worsening difficulty in swallowing of liquid and solids for about 10 weeks duration. There was also associated subjective unintentional weight loss and severe postprandial vomiting. He denied any vocal hoarseness. Physical examination was significant for irregular heart rhythm, S1 and S2 heart sounds, with a grade 3 out of 6 pansystolic murmur at the apex. His laboratory investigation was significant for potassium level of 2.8 millimoles per liter. EKG done at the ED showed features suggestive of atrial fibrillation and premature ventricular complexes. A chest X-ray showed cardiomegaly with a tortuous aorta and an echocardiogram showing markedly dilated left atrium greater than 9 centimeters in diameter, severe mitral regurgitation, and an ejection fraction of 30%. He subsequently underwent an EGD that revealed a normal esophagus with extrinsic compression from an enlarged left atrium. A CT scan of the chest also showed cardiomegaly with massive distension of the left atrium and left ventricle. Unfortunately, our patient developed respiratory distress, requiring intubation, and subsequently passed away during the hospital admission. Dysphagia is a fairly common clinical condition said to affect about 22% of adults over 50 years of age in the United States. It has numerous etiologies, including those intrinsic to the esophagus, such as reflux disease, spasms, neurologic origin, achalasia, malignancies, eosinophilic and pill-induced esophagitis, and Shosky's ring. However, to the best of our knowledge, this is the first time being reported in an individual of Hispanic origin. There is also a number of extrinsic causes, such as dysphagia lusoria, mediastinal and bronchogenic tumors. Cardiac dysphagia, such as the one presented in the patient, is another cause of extrinsic dysphagia. Very few cases of left atrial enlargement induced dysphagia have been reported in literature, with many accompanying large laryngeal nerve paralysis secondary to left atrial enlargement known as cardiovocal syndrome. This 81-year-old male who presented with dysphagia, weight loss, and severe postprandial vomiting was found to have cardiac dysphagia after a chest X-ray, CT scan, echocardiogram, and EGD were done. Unfortunately, due to the patient's comorbidities, the patient developed respiratory failure, requiring intubation, and the patient passed away in the same hospitalization. This is a rare case in which caused the Hispanic male prolonged suffering, eventually passing away from an event related to this condition.